Hello, everyone, and welcome to the Flint Community Webinar, your community resource. I'm so excited to be back. I know I missed you last month, but this month we've got some really amazing resources and topics that we're talking about, and really timely topics that we're talking about. So we've got a bunch of wonderful expertise that we're bringing you here today. We're going to start with Dr. Caitlin Lyroff, who's going to talk to us a little bit about COVID-19. She's an infectious disease specialist. And then we're going to get into a little bit of a roundtable. So we've got Dr. Shannon Garceau, and we've got Dr. Michaela Corsi, and we're going to bring Dr. Caitlin Lyroff back into that discussion and have a little roundtable to talk a little bit about the things that are going on around COVID, what's important, where to get vaccinated, all those wonderful topics. We've got Yvonne Lewis back with us and Dr. Chelsea Wentworth, who are going to talk about HFRCC and the upcoming research symposium, and Jamika Thomas. So we've got a wonderful lineup for you today, and I'm really excited to get started. All right. I think we're going to start with Dr. Lyroff, who's going to talk to us a little bit about COVID-19 and flu. And this is so timely, as you know, I don't know if for you, but lots of people around me are sort of catching little viruses, and I'm just getting over something that one of my kids brought home. So it's definitely the season. And Caitlin, talk to us a little bit about sort of the current state of COVID-19, what the recommendations are, what's COVID, what's not. What are we supposed to do right now?
Yeah, all very good points. I'm just going to share my screen here. Can you all see it okay?
Perfect.
Okay. Yep. So I'm going to talk about COVID-19, but there also are a lot of other viruses going around, and I've gotten a lot of questions, especially these days as people are kind of testing less and going more based on symptoms. It's important to kind of think about these respiratory viruses together. But I will focus on COVID, and in the roundtable, I'm happy to answer any questions. So my name is Caitlin Lyroff. I am an infectious disease physician at Hurley Medical Center, and I also am lucky enough to work with Heatherlyn and Dr. EJ on various projects and with other students and residents at Michigan State University. So without further ado, I want to make the point that all of the information in this PowerPoint is publicly available and accessible either on the Centers for Disease Control website or on the Michigan Department for Health and Human Services or on the Genesee County Health Department website. Our Centers for Disease Control really does a lot of work on virus surveillance, and you can actually see updated numbers with many different viruses and other information about those viruses through the National Respiratory and Enteric Virus Surveillance System. I also just wanted to make a quick note. This was actually an email that we got today, but there is an increased rate of pertussis, also known as whooping cough, in the community in Genesee County. There's been 11 cases reported so far, which is a sharp increase. As from only 2020 to 2023, there were 7 cases. So the most important thing you can do, and this will come up throughout this PowerPoint, but is to really get vaccinated. Pertussis vaccines are often given as part of the tetanus and diphtheria. So Tdap, tetanus, diphtheria, and pertussis. You can get one of those every 10 years, although it's most effective within the first 2 years after vaccination. And it's also recommended, especially for pregnant women, to try to give some immunity to their newborn babies against pertussis. So to start with, this upcoming respiratory season is thought to be about 80% chance of the same or better than last year, which is honestly really good news for all of us. As you can see, 2023, 2024 was down from 2022, 2023. And so, that is a hopeful thing, but we still have to do what we can. So in general, the Centers for Disease Control has kind of updated their guidance after you get one of these viruses to focus not just on COVID, but also, any sort of respiratory virus. Again, given that people aren't testing as much and that testing is imperfect. And, they are recommending that you stay home and away from other people until your symptoms are getting better, you're fever-free for 24 hours without meds. And then after that, that you take added precautions for the next 5 days or so, like wearing a mask. With COVID, the recommendation, if you're in the community, is that you isolate for 5 days and then wear a mask for the additional 5 days. So just a brief review, a lot of this you'll know, so I'm going to go over it more quickly, but COVID-19 is the shortened name of what is called in the medical community severe acute respiratory syndrome coronavirus 2, much less catchy, SARS-CoV-2. And of course, it was, named COVID-19 for the public. And it is a virus that was first caused by zoonotic transmission in 2019, which is to say that the virus went from animals to people, most likely a pangolin in Wuhan, China was the original site it was linked to. This is a virus that infects respiratory cells, but it also, because it uses a type of receptor called the ACE receptor that's on a lot of different cells, it has a lot of different areas of action as well, which leads to some of the myriad symptoms that individuals get. The current predominant strain in the United States is the KP2, which is a variant of Omicron. And the vaccines for this coming respiratory season are containing different lineage or, different valents. So the JN1 lineage, which includes both JN1 and KP2, will be included to cover, the majority of the infections in the United States. You can find on the CDC website this very detailed information. I'm not going to go through it because this is real, like deep in the weeds with virology, but you can find updated and published information about, what strains are going on at what period of time and what proportion of the cases can be attributed to which strain. As we all know, the symptoms of COVID-19 are, many, and they range from asymptomatic to severe disease. The symptoms generally begin about 2 to 14 days from exposure. And on average, the most severe symptoms tend to last about 2 weeks. The predominant symptoms that people report getting, of course, are fever and chills, cough, shortness of breath or difficulty breathing, sore throat, congestion or runny nose, new loss of taste or smell, fatigue, muscle body aches, nausea, vomiting, and diarrhea, which is less common, but still definitely part of that COVID syndrome. Additionally, with different variants, some symptoms tend to be more prominent than others. So with some of the newer variants, the Omicron, sore throat has been pretty prominent. And so there are many factors. I know the font on this slide is way too small to read, but I just want to emphasize that there's many factors that are associated with more severe COVID-19. And that another reason, aside from just the immediate infection, another reason we care about COVID is that it can lead to many long-term complications. There are some inflammatory complications that occur when the immune system is overactivated, including multi-system inflammatory syndrome, which is much more common in pediatric patients, Guillain-Barré, which is a progressive weakening syndrome, and then pericarditis or myocarditis, which is inflammation of the heart, neurologic complications if the virus causes inflammation in the nervous system and in the brain. Infections with COVID can also predispose you to further fungal or bacterial infections. Blood clots are a common complication associated with the inflammatory state of the virus. And of course, one that a lot of people are talking about today and is worth addressing is long COVID. And this has actually been found to be in about 7% of adults and 1% of children since the onset of the pandemic. So the New England Journal of Medicine has recently published an article defining long COVID, and there are guidelines about how to define long COVID, both from the CDC and from the World Health Organization, and they overlap quite a bit. These are taken from the World Health Organization. I just think they're a little more generalizable, but the recommendations are virtually the same. So in order to qualify for long COVID or post-COVID-19, you need to have a history of probable or confirmed infection. The symptoms have to last for 3 months from the onset of your symptoms, and that they have to last for at least 2 months, as some individuals have said symptoms go away and then come back. And also that the symptoms cannot be explained by an alternative diagnosis. The most common symptoms are fatigue, shortness of breath, cognitive dysfunction, and these have been found to be really limiting to many people and to have an impact on everyday functioning. The symptoms can be new onset following recovery, or they might just persist from the initial illness. And some individuals report symptoms that fluctuate or go away and come back multiple times over time. And this, because the virus in general was seen to cause less severe disease in children, we're still working on the pediatric diagnosis of long COVID for children. I also wanted to highlight that these symptoms are really not uncommon. 15 to 87% of people report fatigue after COVID, after they recover from the initial infection. 10 to 71% report shortness of breath, chest discomfort seen in 12 to 44%, persistent cough in 17 to 34%, memory changes, concentration, even mood changes have been associated with kind of that post-infectious syndrome. In general, of those who have these syndrome, about 50% report diminished quality of life. And about 10% of individuals have many other different symptoms that occur so rarely that they're kind of hard to put in this more generalizable information. So this is from the New England Journal of Medicine article on long COVID. It basically reiterates what I said earlier, the point being that, when you get an infection, it can kind of stimulate the immune system. And so a lot of these long COVID effects are related to overstimulated immune system for prolonged periods of time. Looking now at the current situation of COVID, the Michigan area has about 15 to 19.9% of infection. In Michigan, the percent positivity in Michigan has been about 18.6% through August 31st. This is a slight improvement, a slight worsening of test positivity the past 2 prior weeks. Additionally, as of September 6, 2004, the percent of deaths due to COVID-19 in the past week was 2.1%, which is a change of about 61%. These percentages are overstated because we don't actually have that many deaths from COVID anymore, but that is an increased rate. This data is all available on the Michigan Department of Health and Human Service website. And I just want to point out that we're really heading into that virus season. When people go back to school and go back indoors, we definitely start seeing upticks in people presenting to the ER with symptoms consistent with COVID or with other respiratory viruses, such as cough, runny eyes, runny nose, fever. And those numbers are definitely increasing as far as the overall trend. Even if they might change, from day to day or week to week, the overall trend is definitely increasing. And so in Genesee County specifically, it was hard to find exact kind of the moment data for me, but I did want to just take a look and kind of compare what's been changing with COVID in recent years. And as you can see, in 2024, there were only 3,367 cases compared to 53,519 during the peak of the pandemic in 2021 to 2022. And also in 2024, there were still 42 deaths attributed to COVID-19. Overall, the death rate from the virus in Genesee County is declining. The death rate of cases in 2020 was about 2.36%. And as of 2024, the rate is about 1.24%. So overall, I think some of these cases, it's difficult to say these are actual numbers because, like I said, people are just not testing as frequently. There was a time in the hospital where we were doing a lot of screening of patients just on whole units, and we're not, doing that the same way anymore. So I think these case numbers need to be taken with a grain of salt. But at the same time, it is good news that the overall mortality rate is declining from infection with the virus. You can see here that comparing 2023 in this pink line to 2024, it seemed like we were kind of lagging behind cases, but we are now currently heading kind of above where the line previously was. So just to kind of keep an eye on that. And then this on the left is just a map of the state of Michigan with a focus on Genesee County, noting that there were 181 cases reported the week of August 31st with 25 average daily cases, but no deaths. Looking at the demographics in Michigan from 2020 to 2024, as far as reported positive cases, the majority of them have actually been in 30 to 39-year-old individuals. There is an increased number of cases reported among women and among minority individuals such as Black, African American, American Indian, Native Alaskans. And there is a higher case rate by Hispanic ethnicity as well. However, just looking, yeah, and you can see here, I just highlighted some of the most influenced groups. So in 2024, though, it does look like our pattern's a little bit different. Again, this may be more due to just screening than to actual number of cases, but there definitely were found to be the most cases among the very elderly. This honestly may be because a lot of like subacute nursing homes and nursing facilities do a lot more screening and testing than any other sector, without indications right now. So it also overall is, I'm sorry, this arrow is malplaced, but is affecting women more than men, minority individuals such as Black and African American individuals, and Hispanic individuals at a slightly higher rate. Now, in addition to vaccination, there are treatments available for COVID, including Pemgarda, also known as Pemivibart, which is a infusion, a pre-exposure infusion that you can get to kind of decrease the risk of progression to those at the highest risk for severe disease. This was just added to the recommendations actually in August, so I'm not sure at this point if a lot of hospitals even have that, but if you or someone you know is very immunosuppressed and has a lot of risk factors for severe disease, this may be something for them to talk to their doctors about. Paxlovid, antiviral, we've all heard a lot about. It decreases viral replication, but it's not recommended for use for individuals less than 12 years old. A lot of that may just have to do with the way it was studied, but that's still the current recommendation. It's not recommended for use in patients with severe kidney or liver disease. And if you do go on this medication, you really need to talk to your provider to make sure there's no drug interactions, because the ritonavir component of Paxlovid is infamous for having drug interactions. Additionally, there is a much less frequently used but available antiviral called molnupiravir, trade name Lagevrio, but it has a lot more limitations. It's not recommended for individuals under 18, not recommended for use in pregnancy or even anybody who's trying to become pregnant or thinks they could become pregnant, and it's not recommended for use in breastfeeding. And if you are on the medication, you probably should be on some sort of birth control or contraceptives. The reason being that this antiviral, in some of the studies, there were concerns for fetal abnormalities associated with concurrent use of it. Additionally, there is an antiviral called remdesivir that decreases the replication of the virus, and it can be used to decrease disease progression if you are diagnosed early in the disease without many symptoms. And then if you end up getting admitted to the hospital and put on oxygen, treatment is 5 days of that infusion. For severe COVID-19, that's if you're in the hospital requiring oxygen or in the ICU, requiring even more support, such as ventilator support. Treatments that are available include steroids, and then medications that are known as IL-6 inhibitors, which decrease inflammation in severe situations. And these medications are tocilizumab and seralimumab. And so all of these are things that you might hear if you or someone close to you gets admitted to the hospital, but they're not, standard therapy for anybody in the outpatient setting. Currently, there are 3 mainly used vaccinations for COVID in the United States. I'm sure you've all heard of the Moderna mRNA vector vaccine, the Pfizer mRNA vector vaccine, and then the newer vaccine is Novavax, which is actually protein-based. This is a vaccine technology that's been used for years and years and years. So some individuals who might be a little bit hesitant with the newer technology of the mRNA vaccine may be more comfortable with the development of the Novavax vaccine. That being said, of course, all of these vaccines are safe. And I have had multiple mRNA vaccines and have had no issues yet. So the vaccine recommendations are a little bit different if you've never received a vaccine before, or if you've received previous doses of the vaccine, and if you're immunocompromised. So if someone's never been vaccinated before and they are 6 months to 4 years old, they're recommended to get 2 doses of the Moderna vaccine or 3 of the Pfizer vaccine. Ages 5 to 11 can get 1 dose of either. And then ages 12 and older, they're eligible also for that Novavax vaccine. And so if you do start off that vaccine series, it's 2 vaccines. If if you decide to go for the mRNA vaccines, then it's just 1 dose of the Moderna or the Pfizer vaccine. If you've received previous doses of a COVID-19 vaccine, which a lot of us fall into, ages 6 months to 4 years can get 1 or 2 doses. And then ages 5 to 11 can get 1 of either. And then ages 12 or older just need 1 dose of any of those vaccines. Now, if you are immunosuppressed, there are recommendations that you get kind of more vaccines initially to, increase your immunity. But then if you've had those vaccines initially, you can kind of fall back to the grouping of those who've received previous doses of a COVID vaccine. And then, one thing that we're encountering a lot are people saying, how do you tell the difference between influenza? How do you tell the difference between COVID? And the truth is, you really can't without further testing. But symptoms-wise, they both have very similar symptoms, including fevers, muscle aches or pains, breathing problems, sore throat. And so really just based on symptoms alone, you can't always differentiate. There are 2 different general types of the influenza virus that cause disease in humans, influenza A and B. I'm including here the type of the genetic material of the virus only so you all have an awareness that this is 1, how we sometimes classify viruses, and 2, this is actually an important part of understanding a virus when you think about some of the antiviral therapies. Influenza viruses can change over time, as all viruses can. The way that this most commonly happens is something called antigenic drift, which just means that as the virus is replicating itself, every now and then there's like a little mutation or an error when the genetic material is getting replicated. And over time, those mutations can accumulate to make different viral strains that sometimes look different when they infect people. Antigenic shift only occurs in type A virus, and that's when a virus goes from an animal to a human. And that has been the source, influenza A, of all of the influenza pandemics. And it's really the only type of the influenza virus that does this. And that's the one we kind of watch a lot whenever you hear people talk about avian flu or swine flu. As I mentioned earlier, the symptoms for the flu are clinically indistinguishable from the symptoms of COVID. Including some individuals, especially children, get diarrhea with the virus. Now, both the flu and COVID are a little bit different than what's known as like the common cold. In general, symptoms with the flu or COVID can be more abrupt, often associated with fevers and chills, headaches, profound fatigue. Whereas with the cold, there is definitely less likelihood of high fevers, less likelihood of headaches. More often than not, there's upper, respiratory symptoms like stuffy nose and sore throat. And in general, the fatigue and the duration of symptoms with the cold tends to be, much less. In general, though, even though the flu is less common than the common cold, about 8% of the US population gets sick from the flu each year, with a range from about 3 to 11%. Just like with COVID, individuals who are more at risk for hospitalization or death, the worst manifestations of severe disease are those who are older, those who are very, very young, pregnant women and women with health conditions. Like COVID, the flu can lead to a lot of long-term issues, including secondary infections, including inflammation of the brain and the heart, and then worsening of any underlying chronic conditions. Overall, there are estimated to be many, many more cases of the flu than that result in the hospitalizations. As you can see, there's about 9.3 to 41 million cases of the flu annually, leading to 100 to 700,000 hospitalizations, into a range of about 4.9 to 51,000 deaths annually. Overall, you can see there are great variations in the cases of flu, and then what percentage of those lead to hospitalizations and death. This chart just shows from 2010 to 2023, the different case ranges, and, structure of outcomes. Right now, there really is not a lot of flu going on. Of course, we're still early in the flu season, the peak of that, tending to be more November through February or March. And so we're all pretty much in the green here. Michigan, actually, if you look on the MDHHS website, they have great publications and data available for everybody at any time. And I just wanted you to see here in Michigan, you can really see how the cases start going up in November and then kind of start coming down in April after peaking usually around February to March. You can also see here, in addition to tracking the number of cases, they also track the different flu strains that are more predominant in the community. I'm sorry, this picture got a little cut off, but I just wanted you to see that the rate of infection and also the distribution of infection and when peaks are does change, from year to year. In general, I recommend everybody get the influenza vaccine. These are vaccines that are designed every season, based on what the main circulating strains are, in order to try to come up with the most effective vaccine for that year's strain of the virus. Beginning in 2024 to 2025, again, all of the vaccines are going to work against 3 different strains of the virus, 2 different influenza strains, and then an influenza B strain. Everybody over the age of 6 months is recommended to get the vaccine. Ideally, I would recommend for most people that they get the vaccine by the end of October. You don't want to get it too early because immunity can wear off over time. And you really want to get it so you're maximally protected, during influenza season. Some individuals who are immunocompromised, though, should talk to their doctors. And as they may be recommended to get the vaccine at different times. In general, there are 3 main vaccine types. There's the standard dose influenza vaccine and then the high dose vaccine, which is recommended for those 65 or immunosuppressed or over 65. And then there's a nasal spray that is sometimes useful for younger people who don't like shots. It's not approved for babies, but it's also not for pregnant or immunocompromised individuals. There are antivirals available for the flu. These are viruses that stop the virus from these are medications that stop the virus from breaking out of the cell, and they're most effective if given early. The state of Michigan is also watching the highly pathogenic avian influenza, also known as bird flu. There have been 16 cases of this reported nationally. It's caused by that influenza A type virus, the one that can do that antigenic shift. And it's being tracked both in humans, but also in poultry and in other cattle. Now, the virus is being watched in the state of Michigan, and it's something that the Michigan Department of Agriculture and Rural Development continues to work with the state, federal partners, MSU, the veterinary school and laboratory to kind of provide surveillance for this. How are we doing on time? I also have more on RSV and West Nile, but I don't want to go over
I think if you can sum it up in like 3 minutes, then we could
Yes.
get to the panel.
Okay, perfect. Yeah, that's what I wanted to check. So I'll just briefly say that RSV is a respiratory virus that primarily causes severe disease in babies, young kids. It's important because it can increase the risk of asthma later on in a child's life. And there are vaccines available, new vaccines available for this virus. And so in general, there is the RSV vaccine, the mRESVIA vaccine, and these are available for adults 60 to 74 who are at increased risk of severe disease, or all adults over 75. There's also the vaccine Abrysvio, which is approved starting at age 60. And then there is a monoclonal antibody. And I really wanted to mention this today because, RSV is the #1 reason for infant hospitalization. It can cause severe disease in infants, and it can also, like I said earlier, increase risk of asthma later on. And so protecting babies against this is really, really important. And one way that can be done is by using Beyfortus, which is a long-acting monoclonal antibody. And then West Nile virus I just wanted to highlight it. There was a question about it earlier, but it is a virus that is transmitted through mosquitoes. It's the most common mosquito-borne disease in the United States. It's really very rare overall, but there are cases, in Michigan. We don't have that many, but every so often there are 8 cases or so. And this virus, can cause self-limited symptoms that honestly sound viral, but usually lack any sort of respiratory component. It's also associated with rash, and then in severe cases, it can cause weakness and other neurologic symptoms. So there has been 1 case in Genesee County in a human, but there is more non-human or animal activity with that. Um, and so with that, I'm going to finish, but I'm always happy to take any questions. I know that was a lot of information. So if there's anything I can clear up either now or in the panel, I'm happy to further discuss. But thank you all for your time.
This was wonderful information. And let's just go right into the panel if I could. Let's bring Dr. Garceau and Dr. Kosi up, and if Dr. G, I was trying to see who's here. If Dr. G and Nurse T are in the audience, we'd love to have them, because I just want to think a little bit about what some of the stuff you talked about, how it impacts patients and communities. And I had one specific question because you mentioned a little bit about Paxlovid, and I wondered your thoughts, because there are people who are like, oh, I need Paxlovid immediately. Obviously, it works better if you can start it as soon as possible. We've also heard of this phenomenon around rebound that people get a little bit worried about, and I wondered if any of you would talk a little bit about that.
Sure, I'd be happy to talk about some of the aspects of Paxlovid and availability and testing. Yeah. Thank you all for having me on here today. It's great to be part of this group. I want to introduce myself. I'm Shannon Garceau. I am the pharmacy manager at the Walmart in Fenton. I am here with Mary Lou today, who is a pharmacy manager at a Walmart in Ohio. So she's visiting me today. When it comes to testing and Paxlovid, COVID, one of the services that we provide at Walmart that most people are not aware of is testing and also treatment of these. So patients can come in and they actually get swabbed. And if they do test positive for flu, COVID, or strep, we have a standing order that we can provide them with medication if needed for this. So there is a fee with it. Unfortunately, we're hoping in the next couple of months that this is something we can bill insurance for. However, when you compare it to going to an urgent care, ER time, it is very affordable for patients. So there's a small assessment fee of $70, which patient will come in, we assess them, symptoms, any lab values like for Paxlovid, GFR, and we assess them, we swab them, and if they do test positive, we can prescribe Paxlovid. On top of that as well, something we actually did today, we had a patient that had done a home test, tested positive for COVID, and we can also do this as well. So patients can come in and Paxlovid is readily available to them through the pharmacy if they present a positive test. So it's something that a lot of people, like I said, don't know that we offer, and we are readily available and happy to do it for our patients to kind of assist in the community and assist the urgent cares, ERs, doctors' offices, and save the patient a little bit of time.
Yeah, it's such a wonderful resource because, right, doctors' offices in the evenings might be closed, or so to be able to get the diagnosis and treatment is really helpful. I saw Dr. G and Nurse T, I see Nurse T, and Dr. Leroff, if you had any comments that you wanted to make about the Paxlovid as well.
Sure. Yeah, no, I think it's really hard to answer a lot of those questions. One reason being is that a lot of the studies done on Paxlovid initially were done on people who were never vaccinated. So I think, it's, I still recommend it, especially for people that are at risk for severe disease. I think if you are a younger, healthier person, it's always kind of a risk benefit looking at your medications, but may not be something I would push as much. As far as the question of viral rebound is kind of a hard thing. I mean, we do have people who just develop symptoms from COVID even after the virus is gone. So in some of those long COVID contacts. So I think it's really hard to answer that question directly. But of course, I think anytime you take a medication, it's a discussion of risk benefit. And if you're high risk for severe disease, I definitely think there's possible benefit.
That's super helpful because it's a question we get a lot. So if you're high risk and you've got a severe symptoms and you're high risk for severe COVID, then definitely talking to your provider or heading to a Walmart that has these services to get Paxlovid in your diagnosis. I want to think too a little bit about the availability of vaccinations locally. So I was hoping Dr. Corsi could help us think about, could we go to the health department as a potential source? What does it look like in Flint in terms of getting vaccinated?
Yeah, absolutely. So we at the health department, we are still officially waiting on our COVID vaccine shipments to come in, but we are anticipating that's supposed to ship next week. So we should be armed and ready pretty soon. We are going to also be getting our flu vaccines. I know we've talked about that as well here next week. And so we have a couple options. So of course, you can get your COVID and flu vaccines as well as any of your other vaccines at the health department. But I really did want to highlight that we have a lot of outreach where we're going out into the community. And this is a really important, as we know, the Bridge Access Program is ending. And so some individuals who might be uninsured or underinsured might not know how to navigate getting a COVID-19 vaccine. And when we go do our community outreach events, those vaccines, there's very limited circumstances in which somebody would not get that, completely free. And so that's something that we really want to highlight and encourage for folks, that if you're not sure about how to get it or how you could afford to get the vaccine because of your insurance status, that we do offer them with no cost out at our community events. And we post all of our community outreach events on our website each month. So if that's a great resource for people to be able to check out. And then we also, for other individuals who might be uninsured who go to the free medical clinic, we also have a standing appointment with them once a month too, where you can kind of get your full medical care and your vaccines as well. But of course, you can always make an appointment at the health department. We have some walk-in dates as well. And then of course, like reach out to your clinicians, go to the pharmacies, if those are resources are readily available to you, we highly recommend just getting your vaccine wherever is accessible to you.
I love this because we have all of the places that your vaccine is accessible on the screen right now. So this is awesome. Really quick before I go to one of those places, Dr. Corsi, I was hoping you could introduce yourself as the new medical director of our health department, which is awesome. So I'm going to give you a couple seconds to make that introduction.
Yeah, thank you so much. So yes, my name is Dr. Michaela Corsi, and I am the new medical director for the Genesee County Health Department. I just started this summer, so I'm really looking forward to meeting more folks in community and doing what we can to push things like vaccination efforts, as well as many other great public health initiatives. So I'm really looking forward to servicing you all. So
Awesome.
Nice to meet everyone.
Thank you so much. All right. I want to talk to Jamika Thomas because we've talked a lot about like where we get vaccines, and the health department has theirs coming in next week. And Walmart's like, we can swab you and test you and treat you all in one. And Jamika, I know you've got this really great drive-through testing or a drive-through vaccine event that you are putting on with GHP. So tell us a little bit about this.
So the Genesee Health Plan is hosting a drive-through vaccine event. This is our 10th year. Can you believe it? It's our 10th year with funding through an N-NICE grant. And literally, you can stop at our location on Linden Road, 2171 South Linden Road, September 27th from 3 to 6. And roll down your window, roll up your sleeve, and get your vaccine. In partnership with Walgreens, Walgreens will be in our garage bay to provide the flu shots, the senior dose, and a regular dose. And then we're doing some work with the health department as well. The health department will be inside to offer flu shots, Tdap, hepatitis B, and also HPV. And this year we have something new. The family planning and sexual health nurses will be on hand also to provide some STI testing with the health department. But yeah, all things vaccine on the September 27th at Genesee Health Plan. And we do also provide healthcare coverage for those in need of healthcare. This is a very passionate thing that has gone forth in this community, and Genesee Health Plan has been here to help those who are in need of healthcare coverage.
That's awesome. Thank you so much, Jamika, for sharing that wonderful resource. I don't want us to leave without hearing from the community, and Nurse T is out in the community. So tell us what you got, Nurse T. What questions do you have for us?
Oh, actually, we don't have any questions. We just want to say kudos, and we want to say that we are live right now at Metropolitan Baptist Tabernacle with Big Brothers Pharmacy. We are hosting a blood drive as well as giving vaccinations. We're giving COVID,
flu vaccines.
the flu vaccines, and so far we have vaccinated about 5 people. And I want to turn it over to this amazing guy. This is in partnership, so we are excited to be able to still be out here and able to partner with pharmacies and be able to create spaces for our community to receive the vaccinations. So I'm going to turn it over to him.
Hello, everyone. My name is Mehul Sureja, pharmacist at Big Brothers Pharmacy. We partner with them on different community events. Matter of fact, we are doing one more tomorrow at the church. We bring out the vaccines on site just in case if somebody walks in. We look up their records to the state maker. We check their up-to-date records on the vaccine if they need any. We do offer it right on the site. Thanks to Dr. Corsi, too. We are right behind them on the Saginaw Street with the health department. So we do get a lot of referrals from there, too. Or we just go out to their homes and we do vaccinate people who doesn't have transportation or they have, disability. They can't get out of the house. So we do offer a lot of services in the community, just like, my fellow pharmacist, I think Shannon mentioned about a lot of stuff about that too. I used to work with Walmart too before. So I know the Walmart is pretty good about, getting patients into their, doors and have them, get the vaccination right away. So, thank you everyone. As a team, everybody in the community, we can make a difference. But anybody needs a home service where they can get out, you can always approach us and we will have somebody, licensed pharmacist or tech. We go out and we do the vaccination. So thank you everyone for your time today.
Fantastic. Thank you so much. And can you tell us the time of your event tomorrow?
It is 8 a.m. Oh, sorry. It is going to be at Grace Emmanuel Church.
Dr. G.
Hello. How you doing? Grace Emmanuel Church on Lapeer Road, and it's going to be from 9 a.m. to 12. And we'll be offering the same vaccinations there as well. Then we also will be at New Creation on September 19th from 9 a.m. to 11 a.m. So we'll put all those out. So we have about another 10 clinics or so going. So we'll put that information out. And like I said, we're up to partner with anybody, and we appreciate everybody's hard work. But one thing, like I said before, the community is asking for new literature and up-to-date information to be disseminated about COVID. And we know, like in the hospitals, the rates are going up as well, and a lot of positivity of COVID around us.
Yeah. So if anybody needs to be vaccinated today or have their flu shot or is willing to donate blood, please come visit us on 930 East Myrtle Avenue. We will be here until 4 o'clock. Thank you so much. And then thank you. That's all I have to say.
Thank you so much. You're always out in the community and we super appreciate you. Dr. Learoff, there was a question in the chat that I wonder if you could expand upon for the whole group, because this question comes up a lot, at least even in my own practice of, gosh, I went to get vaccinated and a few days later I developed symptoms. What's the deal? Why does this happen?
Sure. Yeah, I think there's 3 parts to this question. The first part is that after you get a vaccine, sometimes as it activates your immune system to make those really good antibodies so your body can fight the virus, some people feel some muscle aches, some fevers. That's especially common, with the COVID vaccine. Those symptoms, though, are not the same as getting a virus. Those symptoms go away within 48 hours usually. And so, it's definitely not the same as having influenza or having COVID, which can last 2 weeks, or with long COVID, even more. So I want to make that statement first, that just giving the vaccine can give some mild symptoms of your immune system kind of waking up. The second piece of that is that it takes about 2 weeks for a body to make enough antibodies in order to fight an infection. It's a lot of work for your body to make those antibodies. They're proteins, so your body has to kind of start at the beginning with protein production, and it doesn't happen overnight. So some people, if they were exposed before getting the vaccine, or exposed in that period where they're still developing those antibodies, then they are at risk for getting the infection for sure. The final thing is that there's so many respiratory viruses. I highlighted just a few in this talk, but there's many, many, many more. And so a lot of times people might get another virus and so think that they, have contracted the virus they got the vaccine for. The final piece I'll add, I know this is a 4th piece, but it's important, is that, the influenza vaccine, I never want to be dishonest with anybody. It's not always 100%. Usually it's around 50%. That being said, even if you take the vaccine and you get influenza, it's less severe and you really have much better outcomes. So even if the vaccine isn't 100%, it does offer some partial immunity, and I still recommend getting it. But, I always believe in being honest with patients, and, the influenza vaccine, because it's always a guess really of what the main circulating variants will be, is never 100%.
Yeah. I will often say to people, it takes about as long for the vaccine to work as it takes your hair and nails to grow, right? The protein too.
Yeah, exactly.
And so as you're making new protein, it's a similar process. I really appreciate those answers. That's super helpful. There was another question here that was about the variants of COVID. And so one of the things that people in public have kind of noticed is that maybe there's been a decrease in the severity of some of our variants. And I wonder if you talk a little bit about that.
Yeah. So, when you think about viruses, every organism in the universe does what it can to meet its own needs, right? And so if you're a virus, what's going to be the most effective thing for you to be? And that would be something that has a low mortality, but is highly transmissible. And so the longer, a virus can be asymptomatic, the more it can transmit. So all of these things put force on the virus to kind of evolve in that direction. So in time, we have seen the virus have lower mortality. Part of that is also related to people having prior vaccinations or infections that give them some sort of immunity. But definitely the virus is getting less deadly than it was. And, to that end, other symptoms are less pronounced than they were with like the first iteration of COVID. Just anecdotally, in the hospital, people are nowhere near as sick with the infection as so many were, back when it first started. Although if you are immunosuppressed, if you are older, you can still really get very sick. So I'm not trying to undermine that at all. Some strains do have some symptoms that are more prominent than others. The Omicron strain, there's been a lot of sore throat. So they are a little bit different for sure, depending on how they've mutated. There was a question saying, are people getting more sick with like the very newer strains? I think that's hard to say because a lot of people aren't reporting testing. And a lot of people only test when they're symptomatic. So it's hard to say how people are telling you they feel with this newest strain, if that's just representative of the portion of people that have symptoms or the portion of people that are testing. So I couldn't answer that with any real reliability. But definitely the strains can be different.
Yeah. And this question might be for Dr. Corsi as well as yourself. Dr. G was talking a little bit about the increased rates in hospitals and sort of that we're seeing this increase. Are you seeing this increase, Dr. Corsi, sort of in data across the Genesee County that we've seen sort of that bump in rates? And what other strategies should we be thinking about to make sure people are aware?
Yeah, we definitely are seeing that increase in rates. I think Dr. Leroff did have some data from the county in that presentation, but for anyone who missed it, yes, we are certainly not isolated here in Genesee County. We're seeing the same kind of changes that we're seeing across the nation in terms of a spike in cases across the summer of COVID-19. At this point, we're not seeing really the other respiratory viruses take off quite yet, but that's not unexpected. We would anticipate that not for several more weeks. I'm sorry, what was the second part of the question?
I just said it. Are there strategies that you all at the health department are using to make people aware, and are there things that we should be doing as people who are tuned into this webinar to make sure people are aware of even resources like Walmart or the Genesee Health Plan drive-through event?
Yeah, absolutely. So I think we're working on kind of some of our media strategy and what we want to do and putting information out about that. We were somewhat delayed since we were still waiting on our COVID-19 vaccines, and we wanted to be able to not only point people to the fact that we see an increase in cases, but also the directions of how we can provide resources and how people can protect themselves. For us, I think our biggest messaging is going to be, get vaccinated. Again, it might protect you from illness, but if it doesn't protect you fully from illness, it's going to prevent you from that severe disease. And then really stay home if you're sick, wash your hands frequently, like all of those good things that we know prevent spread of illnesses in our communities. And I know we're working very closely with the schools so that way they know that they feel confident in their infection control practices as people, start having more go back to school and they're all around each other and there's more circulation of virus in the community that, coincides with that going to school and things like that. So I know that's some of the outreach we're doing.
Fantastic. I want to ask Dr. Garso the same sort of, what are you seeing people walk into the facilities with, and what are the asks for? What do we need to be thoughtful about in terms of resources that we need to make sure get to people?
I think right now we're just focusing on vaccinating all of our patients. We do have availability of COVID, all the flu, the standard flu, high dose flu, just getting people vaccinated. And we also, all of the stores in this Genesee County area, Walmarts, we also have access to MICR. So we're also running MICR for all of our patients and offering all those other vaccines like tetanus, the RSV, like we talked about. So just getting out there. We have table events a couple times a week. So we're out there talking to just people that might not be our patients, but just people in the community that we want to get vaccinated and just prevent the spread of the illness.
Got it. And then there was a question in the chat that you might also be able to answer is, when do you get high dose flu and who should get that?
So high dose flu is for anyone over the age of 65. Everybody else will get the standard, which is either flu block or we have flu zone. I don't know. We do not have the flu mist available here at this location. I'm not sure what the availability is at the other stores, but we do have all the other forms of it.
Fantastic. I'm going to give everyone on the screen an opportunity to have one last comment that they want to make sure people walk away with regarding COVID, flu, any of the viruses that we're running into right about now. And I'll start with Dr. Liroff.
Mine's probably predictable, but I would say just get vaccinated. They're wonderful, wonderful technologies and can really make a big difference. And yeah, that's all.
Dr. Corsi?
I would probably just agree. I really just strongly recommend that people get vaccinated. And then again, if you're not feeling well, stay home. I think that's one of the best things you can do as long as it's within your capability. Try to protect others around you as well.
And Jamika, will you mention a couple of details around your event again as well?
Yes, vaccines are designed to protect, and I think I've heard that several times here today. The event is September 27th at the Genesee Health Plan, 2171 South Linden Road from 3 to 6. There will be 2 ASL interpreters on hand, and if English is not a primary language for folks, we do have someone to interpret for those people as well. Flu shots will be available in addition to HPV, hepatitis B, Tdap, and the health department will also be offering some STI testing.
Fantastic. Thank you so much. And Dr. Garso, any last comments?
I think to kind of echo everything, just educate our patients, talk to them, those that are against vaccination, let's see why they're against it. Are they just not informed? Are they not just understanding the significance that they can have in protecting themselves and others? So education is a big thing that we find here at the store level, and talking through those barriers with why a patient might not want to get vaccinated.
Fantastic. Thank you so much. I'm just checking the chat because I'm making sure we're not missing anyone's questions. And I know I said last. The only last question we had is there was a question about if people should be concerned about the delay in testing related to symptoms. And that can be anyone with the expertise who wants to answer.
What do you mean by the delay in testing? Like if you get tested days after your symptoms start, or
I think the question is around, like, if you have symptoms, can you trust that the test, a negative test, can you trust a negative test?
Got you. So it's the truth is probably not. If you have symptoms, I would follow the CDC's respiratory virus recommendations, which is to isolate with your symptoms, to not be around people until your fever resolves without medications, and to probably wear a mask or take precautions if you have to be around people. The testing, depending on which type of testing you're doing, they have different levels of sensitivity and specificity, how well it tests what it's testing. And so that can also change at different periods of the illness. So I think the most important thing is to really go from your symptoms at this point. And that way we can decrease transmission of all of these viruses.
That makes a lot of sense. I want to say a huge thank you to this entire roundtable. What amazing expertise we've had here today. What amazing community partnership. I really appreciate all of the support and all of the education that you've provided the community with today. Thank you so much for all of it. We are going to, it's kind of a pivot. It's not entirely a pivot. We've got wonderful people talking about community resources and how they're bringing trusted information to the community. So it's still on topic. I'd like to bring Dr. Wentworth and Yvonne Lewis to the screen to talk a little bit about the HFRCC Symposium. Oh, and in new Zoom land, I've forgotten to go over this little COVID-19 snapshot, which just gives you a really nice summary of all the things we've talked about today. Remembering that vaccination matters, the new and most current recommendations, get your vaccine, and factors behind declining risk related to COVID.
Thank you, Dr. Jennifer. It's good to see you today.
It's great to see you.
And just thinking about listening at the webinar today is where we started talking about COVID almost 3 years or 4 years ago now, looking at what was going on with COVID through the HFRCC. The webinar started, and so we're here today with our annual symposium that's coming up. And the two things we talked about during those weeks, many weeks, was both COVID and the flu. And our theme for this year is keying in on research to action, and it shows based upon the information that was shared today how research has provided for us information that we didn't have when we first started the webinars all those years ago. So Chelsea's going to give us a quick update, a rundown on what's going to be happening at the symposium, and we just want to encourage you to come out and be a part. And thank you.
Thank you so much, and thanks to everyone for this great presentation. I know that the webinar for me has been a really important source of knowledge and information for many years. So I'm Dr. Chelsea Wentworth. I'm one of the many co-directors of the HFRCC, the Healthy Flint Research Coordinating Center. And Heatherlyn, if you can put us onto the next slide, I'm also going to share in the chat for everyone this link where you can register to join us for the annual research symposium. So this will be on September 27th from 9 a.m. to 3 p.m. We do ask folks to register, but it is completely free. And we will also be providing lunch free for everyone. So it's a great opportunity to come downtown and at the Riverfront Conference Center and learn about what's happening regarding health research across the city. So we have a number of great speakers lined up throughout the day. And we will be hearing from, in both oral presentations and in poster presentations, from a lot of researchers who are working over the years doing research in partnership with community and on health-related issues in Flint. And so this is an excellent opportunity to learn a little bit more about that, to be able to ask questions informally, one-on-one of researchers, to learn more about what's happening and to see what's relevant to you, and to network and think about ways that you might be able to get involved and learn a lot more. So we do this at the HFRCC every year in the fall, on the last Friday of September. So we're excited that this is coming up. Again, the link, you can go to hfrcc.org and find the registration link there. The full registration link is also at the bottom of the screen and in the chat if you'd like to click directly on that. And we ask that you register by Monday because we are going to be ordering for food and such, and want to make sure that we have enough for everybody. So please do go and register soon so that we can have enough for everyone. But we're very excited about this and are looking forward to hearing about what's happening and how we can foster great conversations going forward and launching another year of great research in Flint. Yvonne, do you want to add anything else?
Just that there'll be opportunities for participation by community. We'll have some awards that will be presented. So we want you to come out for both community and academic partners who participated. And again, on behalf of the Healthy Flint Research Coordinating Center and our partners, which this webinar has just been such a critical part in getting information out to all of our community members as it relates to some of the research that's going on and impending research. So we look forward to your participation and again, making sure that we have credible information that you can benefit from, just as was shared by all the partners on the webinar today.
Thanks so much.
Thank you so much. What a wonderful webinar. All right. I want to thank everyone again who contributed to this wonderful expertise. A thank you to Dr. Garceau, a thank you to Dr. Learoff, a thank you to Dr. Kosi, Jamika Thomas. Thank you for letting all of our people know about the GHP event. Dr. Gianursi, always here in the community. We appreciate you. Dr. Wentworth and Yvonne Lewis, always a pleasure to have you. A reminder about continuing education units for community health workers. We'll see you next month. Stay safe and stay healthy.